Feeling good?
Yeah, I feel great. Yeah, I feel great. I can feel like I take on the whole world right now.
My name is Brandon. I've been practicing martial arts training for about 7 years now. How long I've been doing it, it feels like it's been like twice as long. So I want to say, because I've been doing 2 a day. So I train in the morning, train at night. So I put my body through a lot of like just hard grinding, training, just every day, teaching it as well. So with martial arts, you know, and injuries, it goes hand in hand. The injuries, like, they come and go, you know, new ones come mainly, but for the most part, you know, it's really just like joint pain and stuff like that.
Hey, what's up, man?
What's up, bro?
Good seeing you.
Good seeing you too.
I like seeing you on better terms, but
Yeah.
I'm figuring you're dealing with something. What's going on?
Yeah, so I mean, I got my back, you know, I've been dealing with it since like February.
Okay.
You know, my back got messed up, like in training right after my fight, which your brother was treating me right before that.
Okay.
Ever since then, I started going to see the chiropractor, and then today was actually my last appointment. For the most part, like the last 4 weeks, they've been killing me because it's just, they don't really do much.
Yeah, it usually feels pretty good. Does it give you any relief?
To be honest with you, I don't really feel any different.
Okay. Okay.
Yeah.
So when you said since February, your back's been like constantly hurting, up and down, good days?
Yeah, it's
bad
been up
days?
and down.
So are you still training then? So you've been training?
Yeah.
So you're not taking any time off, so getting back into it.
Mm-hmm.
Yeah, I mean, there's some level of rest that's gonna help.
Right.
But you flirt that line of like too much rest, then you're have this uphill battle in rehab.
Yeah.
Trying to now gain back strength and deal with the pain. So
Exactly, yeah. There was like points in training where like my back would stiffen up, right, like bad. And I think your brother, he would just tell me to like pressing up. So I literally just like stuck to that, like for whenever my back pain would like come in, and it would, actually, honestly, it would give me some type of relief.
Okay, all right, good. That's a good sign. You want to be able to control at least something, like pain management wise.
Right.
Like something's got to be working, and then that gives us a better idea of how we can also help you in the treatment. All right, let's check out your hips, make sure they're level. So I'm gonna have you bend your knees up. You can lift your hips off the table. Good, come back down. Fully relax, don't fight me. Pretty good. So sometimes with pain, your hips can get out of alignment.
Yeah.
You do actually look a little bit out of alignment here, like your hips rotated down anteriorly.
Yeah.
And I feel that like your quad's pretty tight. So I feel like that has something to do with it, with your hip flexor.
Right.
So for that, let's start with the quad and then we'll work our way up. And I know that'll come correct. And your hips are more level, things are gonna feel a little bit more balanced.
Right.
Sometimes when your hips are off like that, you sometimes feel like your stepping is off. Try to get everything to normalize, and then you can start to train, you know, with your body in balance, and you'll get more benefit from it. Let me know how it feels. Like, I'm gonna keep trying to gradually go in and have you not fight me.
Yeah.
But if I feel like you're fighting me, or if you're thinking it's a little bit too much right now, try to ease in a little bit more.
Okay.
Oh man, these quads, they're tight, they're dense.
Yeah.
You said you were a fighter, right?
Yeah.
Actually, you know what? I think I know somebody who can help out. Nick, hey, you free? I got this Tiger Showman's fighter. Probably can use your help. All right, cool. All right, let's get back to treatment here. Let's open up this hip flexor here. Since I was told your hip is rotated anteriorly. Where you feel it going down the front of your leg or the back of the leg? Remind me.
So it's the back of my leg, but like on the right side.
Okay.
Yeah.
All right. And then you said you got back to training.
Yeah.
How's it feel when you're training?
You know, it's funny, it feels fine. Like, it feels perfectly fine. It's like when I'm not doing anything, like if I'm just like laying down or sitting down, like that's when it'll flare up on me.
Okay. So is that at like night before bed type of thing? You get any sleep?
Maybe like when I'm sitting in the car for like a long, significant amount of time.
Okay. Okay.
You know, like 30, 40 minutes.
Yeah. So I mean, in that position, when you're sitting down,
Yeah.
and you have you have a herniated disc.
Yeah.
It's like a jelly donut. It's gonna poke out more, and it's gonna hit that nerve. And right now, you're feeling it down your
Right.
right side here. So what we gotta do is we gotta take the tension out of these muscles and deload the back, right? Take some pressure off the back by hitting your hip flexors and try to allow that disc to go back in, right? All right, how'd it go?
It went great, honestly. Like, I enjoy the whole experience every time.
Hey, feeling good?
Yeah, I feel great. Yeah, I feel great. I did feel like it's like on the whole world right now. Coming into the treatment, I was like, man, I need this, like ASAP. Like, I'm dying right now. Like, my hips, everything hurts every day. And then right now, I feel like 100, like, I would say like 100% on the other side of the fence of it. Like, I feel completely loosened up. I feel relaxed. I feel like, honestly, I could probably take a fight this weekend. But, you know, for me, like baby steps, you know, just working on covering. And I think like this, consistently doing this will help me do that.
Muscle therapy, I can't stress it enough. I think it's important for fighters, for any contact athletes, for all athletes, right? You want your muscles to be long and unrestricted. You want that freedom when you're out there competing. You're just gonna perform better. Yeah, and you want to be able to perform, right? And this is something that you're going through. So the healthier you are, the healthier your muscles are, not only the better you'll perform, but you can stay out there. That's the whole point. We want to be out there. We don't want to miss any time. So if you like this video, be sure to like and subscribe. And if you have any questions whatsoever about muscle therapy, please ask. We're here to help, educate, and we're trying to spread this message. We'll see you in the next one.